Hello everyone, and thank you for watching this video. Today I am with Brown & Brown Dentistry, and I have with me Dr. Cindy Brown. Hi, Dr. Brown.
Hello, Esteban.
Thank you so much for hopping on this video, Dr. Brown. And you're probably watching this video because you're looking for dental services in the areas of Pompano Beach, Lauderdale by the Sea, Margate, and surrounding areas. And today we're going to answer the question about brushing. How should you brush your teeth? And also about flossing. How should you floss your teeth? Dr. Brown, let's talk about flossing and brushing.
Well, dental flossing is important. It's important that you floss every day. Excuse me. It's important that you floss every day in order to remove the bacteria from in between your teeth. And it removes the food too, of course, but the bacteria are what cause decay and periodontal disease. So you use the dental floss to scrape the bacteria off of the side of the tooth, and that kills the bacteria. Really, that's the most effective way to remove the bacteria in between your teeth, is to scrape it off with dental floss.
Okay. And how often should one floss?
You have to floss every day.
Every day.
At least once.
At least once a day. That's
exactly.
Okay, so once is better than 0 times. And what would be the ideal way to floss if you could do it? Should it be done after every meal?
If you can, but once a day should be enough.
Okay. Okay, now I know that we prepared a little video to kind of show people how to do it properly. So I'm going to go ahead and share my screen, Dr. Brown. And for the audience, if you're watching, you should be seeing a screen right now where you should see a video about flossing. Dr. Brown, can you explain what is going on this video? Just let me set it up here for proper flossing.
Well, in this picture, they're brushing the teeth, and you can see the toothbrush bristles are pressing in between the teeth. Now they're flossing the teeth. The floss is removing the plaque. The plaque is the fuzzy, sticky goo that's on the side of the tooth that needs to be removed every day.
Okay, so that yellow stuff that we're seeing here, that's what the floss is supposed to remove, right?
Correct.
Okay. Now, is this how we should hold the string? Is there like a specific way?
Yes, that's the best way, is to wrap it around your middle fingers and guide it with your index fingers and your thumbs. Another way you can floss is with a floss holder, and that helps too.
Okay.
But see how they're wrapping it and scraping both the forward and backward direction? That's necessary in order to scrape the plaque off of the side of the tooth. Okay. Just to pop in and pop out doesn't remove the plaque on the sides of the teeth.
Okay. So we really want to dig in there. Okay.
And that shows a picture of the floss holder, which does work well.
Okay.
You just have to pull one way and scrape, and push the other way and scrape. So you're scraping the sides of the teeth.
Excellent. So there you have it. That's flossing. Is there anything else we should know about flossing, Dr. Brown?
I think that covers it.
Okay. So I think one key thing, at least for myself, was that for many years I wasn't a flosser, and I realized that I needed to floss my teeth, not just brush my teeth. A lot of people think that brushing is enough. So in reality, it's not. You got to do both, right?
Correct.
Yeah, I had that belief at one time. Oh, well, at least I brush after every meal, but I needed to go in there and get that yellow stuff out. So
from in between the teeth, exactly.
Yeah. So let's talk about brushing. What should we know about brushing?
Well, when you brush, you want to go in a certain direction. You want to angle the bristles at a 45-degree angle up at the gum or down at the gum, depending on whether you're on the upper or the lower, and jiggle the toothbrush or vibrate the toothbrush, and then roll down away from the gum or up away from the gum, depending on whether you're on the upper or the lower. You don't want to just scrub back and forth. The scrubbing back and forth can damage the roots of the tooth and cause recession, the gums to recede back, and ditching in of the root. So you want to use a soft toothbrush, and you want to use the brush in a specific direction.
Okay. Well, we have a video for this as well to illustrate this. So let's go ahead and pull that up, Dr. Brown. And maybe you can tell us a little bit about what's going on here.
See how they're using a sweeping motion? They're jiggling it at the gum and then sweeping the plaque away from the gum. Rather than just scrubbing back and forth, they're using a specific motion.
Okay. Are there any specific toothpaste that you recommend, or?
I like the toothpaste that are recommended by the Dental Association, and as you could see, they used a pea-sized amount. They didn't use a strip or a ton of toothpaste because you don't need a lot.
Okay. So I guess the most important thing to remember is to brush properly. It's not necessarily the amount of toothpaste.
Exactly. It's the mechanical action of the toothbrush, not the toothpaste.
Okay. So I guess that was showing an old toothbrush. Is that what that was right here? An old toothbrush?
Right.
So if your toothbrush looks like that, it's probably time to change it, right?
Exactly. Yeah, they should be thrown away at that point.
Okay. Now what's going on here, Dr. Brown?
Well, you want to brush the biting surfaces of the tooth in addition to inside where your tongue is and outside where your cheek is.
Okay. Okay. So that's proper brushing. Now, question, Dr. Brown, is there anything else we should know about brushing that was not mentioned on this video?
Well, I think it did show in the video you need to brush your tongue also.
Okay, so tongue is important, and that's a big cause of, it's not brushing the tongue. Does that cause bad breath? Is that one of the causes of bad breath?
Well, and bacteria hang out on the papillae on your tongue, so then that can infect, that can spread to your teeth. So you do have to remove the bacteria from your tongue in order to remove the bacteria from your mouth.
Okay, that makes sense. All right. Now, what are other things that we can use to take care of our teeth at home?
Well, the water pick has a good product. It's a water jet under pressure that you can use to remove the food before you floss and brush. And it does help to massage the gums and remove the food from in and about your teeth, especially if you have a lot of dental work or braces. The water pick should be used first, and it would get a lot of the bulk of the food out, and then you would have to go in and brush and floss.
Okay. So we have a video about that. Let's go ahead and pull that up. Our audience can see. This would be on a water pick. Let's see. Now I have a question, Dr. Brown, on this image right here. This is plaque, right? This yellow stuff on the teeth?
Exactly.
Okay. Now, eventually, we're still going to get plaque no matter how good we take care of the teeth at home, right?
Well, plaque and tartar are two different things. Plaque is soft and can and should be removed by everyone every day. Tartar is hard and cannot be removed without a dental instrument. And that's why you go to the dentist's office to have your teeth checked to find decay, but then also to remove the tartar, the hard deposit that's on the tooth.
Okay, and that, no matter how much you brush, eventually you'll have some tartar on your teeth, right?
Some people have more tartar than others.
Okay. So let's see here. What was that?
That's showing the gums, because of the plaque and tartar becoming inflamed. The
Mm,
immune response causes inflammation of the gums, and that causes the gums to swell and become red and bleed.
okay. So this would be the water pick.
That's the water pick, or they call it a water flosser. The water flosser is a little bit of a misnomer in that you still need to floss with regular floss. But for an elderly patient that can't floss with regular dental floss, it does help a lot.
Okay. And there was showing someone with braces as well.
Right. The water pick is invaluable for someone with braces.
Okay. So that's just showing the different levels.
Right. And you don't want to use it at the highest level. And you want it, as you can see here, put it at a 90-degree angle. They're not pointing it down to underneath the gum. It's at a 90-degree angle to remove the food and plaque from in between. The if you went up into the gum or down into the gum, you could injure the gum.
Okay. Okay. All right. So I think we cover everything. We cover flossing, we cover the brush, and the water pick. Now, one thing we didn't talk about was how does one with braces, if you have braces, how would you floss your teeth? Because it's more challenging to do that, right?
It is. There's a floss threader that you use to thread through the braces, the bracket, and then floss underneath the bracket.
Okay. Got it. Got it. So, Dr. Brown, any final thoughts on flossing, brushing, and using a water pick?
Well, they're all very important for maintaining your oral health.
Okay. Yeah. And what would you say to someone struggling with creating a routine or a habit to use these tools daily? I mean, I'm sure most people brush daily, but I'm almost certain that not everybody flosses daily. What would you say to someone that is struggling with creating a habit of flossing? What's like the best way to create an awareness and to get you to take action to floss every day? Like what's something you would tell us so that we would make it a priority?
Well, what I do is after I eat dinner and clean the kitchen, then I go and I floss and brush my teeth. I don't wait until I'm half asleep on the couch watching TV or reading a book and then I'm tired and I don't care. So I go ahead and floss right after I finish dinner. And then it's done for the night and I don't have to worry about being tired later and trying to floss when I'm really tired.
So energy is important. Don't procrastinate to the last minute when you're exhausted and you're like, I'm just going to bed, because then
Right.
you miss your chance. So it has to be a daily ritual that you do before bed,
Exactly.
before you get sleepy. Okay, that makes sense. Well, Dr. Brown, thank you so much for giving us all these tips about brushing, flossing, and using a water pick. If you're watching and you are looking for a dentist in Pompano Beach, Dr. Cindy Brown is here to serve you. Dr. Brown, if anyone has questions, where should they call?
Our phone number is 954-941-5706.
Excellent. So if you're watching and you enjoyed this video, please remember to like it, share it, and comment. And if you have questions, call the office, and you can also visit our website at drscindybrown.com. Thank you for watching.
Thank you.